Hi everybody, I'm Tammy Belanger and I am a perimenopausal woman. It seems to be a hot topic lately, and it seems to be something that kept coming up more and more often in my practice and amongst my peers, of course. So I decided that it was about time that we look into creating some sort of forum where people, women mostly, can come and just discuss, vent, learn, have some fun, and just see what comes of this group in terms of supporting each other as women going through a lot of body changes that we're not so familiar with. So anyway, I have also been finding that it seems to be a hot topic everywhere. I don't know if folks watched TV the other night when Oprah was on with Halle Berry, I don't know how to say it, Halle Berry, and Maria Shriver. Everybody seems to be talking about menopause these days. And I feel like there just needs to be more education for women, because our parents, our generation above us, really didn't talk about those things. I've mentioned before, I live on an island, only accessible by boat and plane, and we have 4 primary care physicians on this island, 2 of which are male, and the other 2 are female in their 60s and 70s. And pretty consistently, I'm hearing from my clients that they just are not able to have these discussions with the practitioners here on the island. And we just need to have, more openness and more education available for people. What we do have here on the island, and I'm very fortunate to be a part of, is a large contingency of alternative care practitioners, many of which are younger women in their 30s, 40s, getting up there in their 50s, like myself, but those that are, more open to having these discussions, and women that want to be able to be more educated, to educate our children on what is available for treatments, what is common, what is red flags, or what are red flags, what are things that we should all be looking for. So with that in mind, again, we've decided to create this menopause support group, but also the other area on the island that I'm seeing a lot of concern with is our access to oncological care and support for both patients and caregivers and family members around that, many of whom are tied somewhat into the menopause realm when we're talking about those with postmenopausal breast cancer treatments. So I decided to tie both of these things together and do 2 separate little projects. The second being just an in-service to the local oncology staff in regard to both acupuncture and herbal medicine, and how it can be used to support not just those with breast cancer, and menopausal issues, feeding into some of that, but also just general oncology care as a whole. So, as I mentioned, we, obviously, like everybody, I started doing the research, and I have, stacks of studies, both in the realm of menopausal research and that for oncological care, and then also that cross-reference of those for treatment with estrogen-fed cancers. So lots of studies out there specifically in regards to that. Not a whole lot of studies about acupuncture for menopause problems, aside from like the major ones, the vasomotor symptoms that we're seeing. I'd love to see more studies done on some of the lesser known symptoms that women are having. I mean, they're saying there's upwards of 40 different things that can be related to menopause now. So I'd like to see some studies that focus more on that. I did find one that was kind of fun and interesting, though, about using resveratrol for bone loss, maintaining bone loss. So that was kind of interesting, and something that I can propose to people in our group as well. Aside from the studies, other information gathering that we did, or that I did, talking to the women in our community, asking what they're looking for information, and how and where they've been looking for that information. I've talked to some chemotherapy patients here on the island, and also asking how they can feel more supported and what they are in need of. Spoken with the oncology department here on the island, and had a discussion with the head of oncology about, what I do and what I can offer and what we can offer patients as an adjunct treatment, not trying to be a replacement, but what we can offer them as an adjunct treatment to support them through some difficult times during their care. I've brainstormed with the one other acupuncturist that's here on island with me, trying to find out what she's seeing and hearing from her own clients, and spoken with other colleagues, from years prior, also in regard to the same sort of thing. And then I've also spoken to other local practitioners, same sort of thing, about what they're seeing, what they're hoping to be able to offer as treatments and supports for these things, so that we might be able to bring them in as guest speakers, so to speak, in this group, no pun intended. Other professional development resources, I find Dr. John Chen to be a huge asset, both as a physician and a Chinese medicine practitioner, and herbalist, master herbalist. Just has so much to offer, and all of the discussions that he presents have a ton of backed up research to support that. So it's great information to show to other physicians or more medically or more research driven people. So love always using Dr. John Chen's information. Jonathan Law, Amy Sear, Healthy Seminars, eLotus. LASA is now offering some courses, I think, on some of these things. So lots of resources out there, and potentially finding and, using some of these as information during some of the classes could be fun too. Sorry, I'm an girl. So the menopause support group, so I keep saying we, so I've paired up with another local practitioner who is like a health coach and does a lot of meditation and, healthy lifestyle living sort of things. And we've paired up to do this course together, and we've decided that we really just want it to be, like I said, lighthearted and fun. So we have decided that we are going to try to do just potluck dinners here at my office. I fortunately have kitchen space and living room space and lots of space to move. So we're going to do some potlucks and just have, soup nights or something, and have people come. This was a mock-up of the first flyer that we have presented for people. Again, just showing that we want it to be fun and lighthearted. I have created a survey, which is sort of like going to be like a kickoff, but also have prizes to go with things, who seems to know the most information going out, and be able to use them as a resource within the group. But we have, some fun, just silly little prizes that we're going to use. I have some cooling packs. I have a little fan. I have some fun socks, which you probably can't read, but it says, "Did I roll my eyes out loud?" Just something to sort of open it up and get people just feeling more comfortable. We have talked about some varied topics that we would like to have in the class. So let's see, I have thought about just obviously starting off with general information about menopause, what to expect, what's normal, what's not normal, all of that. Some general information about what's offered for treatments. So many women are questioning, is hormone replacement therapy right for me? And, offering more information around that, acupuncture, Chinese herbal medicine, intermittent fasting, some of the things that are starting to be talked about more often. Discussion about the signs or symptoms, what are the most common, all the way down to what are the most bizarre, and maybe we'll learn something from the other women in the group that they're experiencing that maybe is related to menopause and maybe isn't, but if they're experiencing it, maybe somebody else in the group will be also. having a discussion with your partner about menopause and how to get them up to speed and how to get more comfortable talking about this with our loved ones so that they have a level of sympathy and understanding to what we are experiencing. Talking about libido and having fun with some products that are out on the market, rose oil, dewy fruits, some of the things that, maybe others have tried and we can all learn about together. Starting a book club, talking about both, cancer-related books for the oncology type of things, but in the menopause realm, I found some really fun books. See You Later, Ovulator, let's see, Hot and Bothered, What No One Tells You About Menopause, A Thinking Man's Survival Guide to Managing a Menopausal Partner, Midlife Bites, Anyone Else Falling Apart or Is It Just Me, Between Menopause and Dead, and What Fresh Hell Is This? So maybe starting a little book club and having women read this or offering these out to people on a loaner sort of program, I think could be kind of fun. Talking about nutrition for menopause. What can we do to help boost ourselves and, try to prevent some osteoporosis or weight gain and have that be a separate topic even. Talking about the tests that you should request from your physician to order. How do you know for sure if you are a new person in menopause that you are in menopause? What other tests are important to know going forward as we're looking for other red flags? Lifestyle accommodations to decrease stress, and other signs and symptoms so that we can prevent flaring of things like more yang, heat rising, liver yang, liver qi stagnation. What can we do to help prevent some of that? One question I get asked a lot, here on this island, which tends to be a sort of, party island at times, why can't I drink alcohol anymore? Why does it cause my hot flashes to get worse? So along those lines, is all liquor created the same? Again, just having fun and lighthearted times with it. Maybe bringing in practitioners to do some meditation, some yoga, anything that we can sort of find to help us all become a community of women going through all this together. So anyway, just some fun ideas. Trying to wrap this up. How do I know if it worked? Obviously, we're looking for returnees. We're looking for, new topics that people want to know more about. Do we need a larger space? I already am questioning, can I hold everybody that seems to be interested in this? So maybe, contracting out space with our local library might need to happen. Social media feedback, and obviously increased referrals, and hoping to do some surveys around this as well. Action plan sharing, we've talked about that a little bit. Other practitioners, cohorts, people that we're looking to bring in to do different discussions and talks, surveys, etc. And what's next? Taking a look at this model and trying to create the same sort of thing on the cancer realm, taking a really serious, not so fun discussion and making it as lighthearted and comfortable as possible for clients, loved ones, and caregivers. Advancing this model and information so that it can be geared towards the physicians in the area, the 4 that we have, but also we do have some affiliation via Zoom to practitioners up in Boston. So trying to get more of this information up there to them so that they can be aware to refer people here, but also to people local in the area, up in the area, the bigger cities where people are, being diagnosed and where those people live. And then also proposing this information. I'd like to propose the information to the local hospital. So maybe we can advance from here in my office to the local library to being affiliated and hopefully sponsored one day through the hospital facility so that we can reach the masses and they can use their social media connections and advertising to be able to promote this so that we can get more and more women. They do currently have a women and wellness group that they do just in the summers, but can offer, more, further reaching information than I might be able to reach immediately. So anyway, that's it. Hoping to have some fun with it. Open to ideas. Love to hear what people have to say. So thanks so much, and we'll see you all soon.